thank God all too soon the semester have come to an end, and we just want to show you a few tips that will be coming. We started with 13 sessions, and in the first session we discussed the DSM, Diagnostic and Statistical Manual, and what I want you to do is to look at the multi-axial axes that we treated. And you are expected to know especially the first axis, axis 1, which dealt only with all the mental disorders except personality disorder and mental retardation. You also have to look at axis 2, that dealt with only mental retardation and personality disorders. You may want to look at axis 3. In session 2, we look at the causes of mental illness, and we specifically zeroed into the trilogic relationship. You were told that as far as mental illness is concerned, the causes are multifactorial, and we look at the agent, host, environment factors, and we said that these 3 factors relate so that one will be able to break down. And you're also expected to know the examples of the host factors, the examples of the environment factors, and the examples of the agent factors. In section 3, we discussed mental retardation. I expect you to know the synonyms as far as mental retardations are concerned. Some of the synonyms are amnesia, mental handicap, and subnormality, and mentally challenged. I also expect you to know the specific forms of mental retardation. This include trisomy 21, that is Down syndrome, and then Klinefelter syndrome, Kenneteros, and phenylketonuria, PKU. And then know the degrees of severity of mental retardation. That is whether it is mild, whether it is moderate, whether it is severe or profound, and the IQs that goes with it. You're also expected to know the various causes of mental retardation, know the treatment, the management, and how to prevent it. In section 4, we look at pervasive developmental disorders, and we mentioned 4 of them: autistic disorder, Rett disorder, childhood integrative disorder, and Asperger's disease. And we extensively discussed autistic disorder. What I expect you to know there are the causes of autism, the symptoms, the prognosis, and how to manage it as a nurse. In section 5, we look at communication and learning disorders. And the communication disorders, I told you, are 4. We discussed 4 of them. We look at expressive language disorder, we look at mixed receptive expressive language disorder, phonologic disorder, and the final one we discussed was stammering or stuttering. Then we also look at learning disorders, and the learning disorders are just 2. Reading disorder, that is dyslexia, and mathematics disorder, which is dyscalculia. And in section 6, we look at attention deficit and disruptive disorder. Under this one, we discuss 2 topics. We discuss attention deficit hyperactivity disorder and conduct disorder. I just want you to know the signs and symptoms, the causes, and how to manage these disorders, and also know the types. Then finally, we move on to sessions 7 to 9. In session 7 to 9, we look at all the anxiety disorders. And I want you to know all the anxiety disorders, know the causes, know the levels of anxiety, know the types, that is phobic reactions, panic, attack, post-traumatic stress disorder, and OCD, obsessive compulsive disorder, and know how to treat these ones. And then we also looked at the somatoform disorders, which are anxiety-related disorders. We discussed 5 types. We look at the somatization disorder, we look at convention disorder, we look at hypochondriasis, and then we look at body dysmorphic disorder, and finally, we look at panic disorder. It is important that you know the 5 cardinal symptoms of the somatoform disorders. Very important. We also look at the somatoform related disorders, and these are 2. We look at malingering and factitious disorder. And then finally, we looked at dissociative disorders, and this covers section 12 and section 13. That is dissociative disorders where dissociative amnesia, dissociative fugue, dissociative identity disorder, depersonalization disorder, and derealization disorder. I want you to be able to tell me the difference between depersonalization disorder and derealization disorder. So these were the 12 sessions that we looked at during the semester. And I know that as students, you'll be expecting me to give you some tips as far as the exams are concerned. Already, I have posted on Sakar your IA, and I just want you to give me the Ghanaian cultural perspective on intellectual disability. And don't read any textbook. I don't want anything from literature. Go out there and interview chiefs, interview fetish priest, interview traditional birth attendants. I'm talking about people, indigenous traditional knowledge. And give me just about 1,500 words. That's about 2 pages, strictly 2 pages. And give your scripts to your center coordinators, and then they'll forward them to Accra. The end of semester exams will take 70%. And out of these, we'll ask you 30 multiple choice questions that will cover all the 13 sessions. 30 multiple questions, it will cover all the 13 sessions. And then we'll give you 2 essay questions, 2 easy essay questions. And I think I'm going to take them from the somatoform disorders and related disorders. I'm taking them from the dissociative disorders and one of the anxiety disorders, specifically obsessive compulsive disorder. I wish you God's blessings and enjoy the festive occasion. And this has been your affable lecturer, Attiogbe Alexander. God bless you.